I'll be honest, it all started because I've always hated bullies. I was the fat Jewish kid at school, the only fat Jew, well, not the only fat kid, but the only fat Jewish kid at school. And then I went on to being a resident, and I saw those same behaviours. I saw those same behaviours that just didn't resonate with me as being okay. And then I was lucky enough to become part of BOTA, the British Orthopaedic Trainee Association. And actually in the year before I became president, when I was vice president, we thought we should do a census. Because one of the things always challenged to residents and resident associations is, I imagine like a lot of organisations, well, you sit in your ivory tower. You're an echo chamber, right? You just sit there and everyone goes, oh, I think this, and you go, I think that too, and we all agree, and then we say that everyone thinks that. So what we did was a census. And because we're not daft and we know that residents on the whole and medical students are much the same, don't really like answering emails, we made a couple of promises. Number one, we said, we promise to keep the results of this census in terms of who you are and where you're from completely anonymous. We know that trainees and residents are afraid of speaking up, they're afraid that it will have an impact on their career, they're afraid that people will think they're a troublemaker. So we said, we will keep this anonymous come hell or high water. Number two, we said, we will act on whatever we find. If it says that everything's just great, we'll just go to the pub, because it's not like anyone pays us to do this. So if you don't want us to look at this stuff, fine, we'll chill out. And the final thing, because we're not daft, is the orthopaedic training has a final exit exam, which costs about $5,000. So we said, and coincidentally, if you enter this census, we've managed to raise enough money that one of you will be in a chance to win your exit exam paid for, or the cash equivalent. So the average response rate for a survey is between 17 to 23%, and we got about 60%, which says you a lot. Not 100%, because I believe that we could send an email out saying, answer this email for $100, and we'd still not get a full response rate. And the part that I was most passionate about as vice president were these behaviours, was bullying, undermining, and harassment. So we asked a couple of questions. Now, before I talk about it, I feel like I should define these things, because I think bullying and undermining and harassment are often misunderstood, and are often quite emotive words, right? You're a bully, or you're undermining me. So we define bullying as someone using their power to either make someone do or not do something, feel or not feel something repetitively that they don't want to do. That is bullying. Undermining is, we believe, far more common and far more insidious. That's making someone feel small. That's making someone feel worthless. That's making someone feel less than they are. And harassment, certainly in UK law, are the protected characteristics. Sex, gender, whether you are pregnant, sexuality, all those kind of protected characteristics. And we asked two questions. We said, in the last 4 weeks, have you ever experienced those things? And then ever, in orthopaedics, have you ever seen them? And we expected to get some numbers. And what we saw blew us away. The numbers were off the chart. We were seeing between 5 to 10% experiencing them, and we were getting numbers in the 40s, 50s, 60s, 70% witnessing them. This is across orthopaedics. So we decided we had to do something about it. And what came about of it was the Hammer It Out campaign. Now, the difficulty is, how do we bring about this change? And the metaphor I like to use is twofold. Number one, it's very difficult for residents, for trainees, for junior people to turn around to more senior people and say, we'd like you to change, we'd like you to do something differently, because it seems very abstract to them. And the metaphor is brown shoes. If someone came into the room and just said, we don't wear brown shoes anymore. Brown shoes actually upset people. You don't understand why they upset people, but we'll get to that, but we just don't do that anymore. And people go, I don't understand. I've always worn brown shoes. Never done me any harm. In fact, everyone in this room is doing it. And it just seems very abstract to them. It seems very weird. So the next metaphor we use is parenting. Because the thing we were very mindful of is not to make these changes punitive. Not to make it feel like a finger-whacking exercise. You're a bully. How dare you? Because as soon as you do that, people's arms go up. You can't tell me what to do. And the metaphor we use there is parenting. Hopefully, you all had parents who loved you. There's some nodding there, which is reassuring. And that's what we assume that training should be like, a parenting thing. Most of the time, people should want what's best for you. And sometimes they have to tell you off. Sometimes they have to criticize you. Sometimes they have to say things that you don't like. But on the whole, your parents love you and want what's best for you. And then what happened about 15 years ago now is the world turned around and said, you can't hit your children. In fact, if you hit your children, sir, you're a child abuser. That's neglect. You're a bad parent if you hit your children. And a world full of parents went, I'm not a child. Wait, what? And then they stopped and thought and went, are you telling me that my parents abused me? Because this is how I was treated. Wait, has every generation of parents before been awful, terrible people? And that didn't work. That's not how you change things. So what we did is we didn't say, you have to change, you're bad people, you're bullying us, you're harassing us, you're undermining us, woe is me. What we said was, what you've done works. It made you, and you are amazing clinicians that we aspire to be like, but we know that there are better ways of doing things. There's a better way of learning, a better way of training, a better way of teaching people. The other thing we did is we made it not about trainees. The NHS have something called the staff survey, and every year it shows a 25% staff-on-staff bullying rate, and it has done since it started, and nothing's changed. So this isn't a trainee initiative. Hammered Out isn't about junior doctors or trainees or residents. It's about culture. And so then we got asked, well, how are you going to change culture? And what we look for, what I look for is something called tectonic change. Because I think that once you get that big shock, actually the best change, the most effective change are what we were talking about earlier, those small little changes that you don't really notice. The small little changes that really aren't bothering you, and then eventually you realize that the world has moved underneath your feet. And the way we do that is by asking people to do the simplest and the hardest thing, and that's personal change. It is saying, I can't ask you to change the world, it's not in my power, but I can ask you to behave differently. I can ask you to say thank you more. Or if you're like me, I can ask you to apologize when you regularly cock up at work and put your foot in it and say something inappropriate. You go, I'm sorry I said that, I'm sorry, right? You think before you act and you speak. And what we know, and there is evidence out there to show this, is if you personally behave because of the world we live in, the culture we live in, you'll role model. And you'll create a positive culture within your team. And because you'll create a positive culture in your team, people will notice that. They will see that the world you've created for your little team is better. The people who work with you are nicer. The nurses who work in your clinics are happier. The patients who give you feedback are generally chirpier. They always want to be in Dr. So-and-so's clinic, not Dr. So-and-so's clinic. It's just a nicer place to work. And because we're all competitive and human beings, we'll go, how do I get to be like them? They're winning at this. And they go, oh, well, you know when you go to Dr. So-and-so's clinic, he does this and he behaves this way. And that's how I was brought up and that's how I was raised. And you go, okay, fine. And because you do that, what happens is your unit inspires your department. And then departments look at each other and go, why? Why do all the residents want to work in the orthopaedic department and not the ENT department? Okay, fine. Well, we better start doing what they're doing. And we're seeing that now. So we call our campaign Hammer It Out. Since our campaign has launched, the anaesthetists have launched Knock It Out. The emergency departments have launched Call It Out. The GPs are launching Rule It Out. The internists are launching Shock It Out because they've all looked at us and they've said, wow, the orthopedic surgeons are leading the way in culture change. What is this all about? We better do that because suddenly all of the residents want to go work with the orthopedic surgeons. And because that happens, you start to change your specialty. And if you change your specialty, you start to change hospitals. And if you start to change hospitals, you change healthcare. And if you change healthcare, eventually, because everyone has to interact with healthcare, that's how you change the world. And it all starts with personal change. Thank you very much.